Hello and welcome back. In this video, we'll discuss the risk management review, which is a critical step in the risk management process for medical devices. So what is risk management review, you may ask? So once you have done risk analysis, risk evaluation, and you have controlled all the high risk that you have in your company or in your medical device, it's time for you to draft up your risk management files, and you can send it out to your high level executives so that they can review your document, right? So it is a comprehensive assessment of the risk management activities that have been conducted for your medical device, basically. And why do you need to do that is because maybe the person writing the risk management file might not be too familiar with the entire workflow of the process, right? He or she might have included a risk control, but that can affect maybe the cost of your product significantly. So it's always important for your executives to look at the risk management review to see if everything is good, right? And risk management review is usually done before the product is commercialized, but it can also be done during each of the revisions that you're doing on your risk management files for your medical device, right? So what is the purpose of the risk management review? The purpose of the risk management review is to ensure that the risk management plan has been appropriately implemented, right? This means that all of the risk analysis, risk evaluation, and control activities that was planned have been carried out effectively. If you said, hey, we need to do risk control for 10 different hazard or hazardous situation, it'll make in the review, it'll make sure that you have done those accordingly, right? And the another very important steps or the reason why risk management review is important, because you want to make sure that the overall residual risk of your device is acceptable. So what that means is any of the remaining risk associated with your device has to be considered low when you compare to the benefit of the device. That's what we call benefit risk analysis. No medical device will be safe. You have to keep that in mind. If you're going to put it in your body, or if it's going to be a catheter, it is affecting people in some kind of way, right? But is the medicine that you're giving, is the health benefit that you're providing with your medical device, is that greater, or is there more harm than the risk that or benefit that you're providing? So you need to look at the overall risk, right? And appropriate methods are in place to collect review information in the production and post-production phases. This means that the manufacturer or your company has a system in place to actively collect and review information about your device safety throughout its life cycle. So that's what I was talking about in the field. You need to be able to have certain kind of process, such as complaint handling or getting information back to your risk management team, so that you can actively analyze risk of your device throughout the life cycle, right? And you may be wondering, who should do the risk management review? So risk management review should be conducted by a team of people with appropriate authority and expertise in your company. The ISO 14971 calls them a top executive. They are basically the team that should include representatives from different functions within the organization, such as design and development, quality assurance, and regulatory affairs, right? And the executive team from that department, because risk management is very important. The company shouldn't put a blind eye on the risk, because that can have a fatal injury to a lot of their patient if it's not looked at it properly, right? And the documentation that you need to have is a risk management report, along with DFMEA, PFMEA, and all the risk management files that you have created for that device, right? So you basically make DFMEA versions, revision 1 for example, PFMEA revision 1, and you do benefit risk analysis, and then combine that into risk management report, and that'll be sent for the review, right? So to conclude, risk management review is an essential step in ensuring the safety and effectiveness of your medical device. By carefully reviewing the risk management activities that have been conducted, manufacturer or your company can ensure that the device are safe for your patients and meet all the applicable regulatory requirement, right? It's not just about keeping your device safe. It has a lot to do with, if you don't do risk management per ISO 14971, most times you can't even sell your devices in different countries. So it's also a regulatory requirement. So that's all I have for this video. In next video, we'll talk about post-production activities such as continuous improvement and other post-production activities. So I hope this was helpful. We did cover quite a bit of information here. Basically, to summarize, what we talked about is the risk management review process, right? It's very important. Usually top management do it, and you need to get their consent because some of the risk controls takes a lot of money and time, right? If you're saying your design is really good, but because how they're assembling in the production facility, if they're messing up your device and if that's affecting the health of the patient, then what you need to do is you need to basically put more QA, quality assurance, or quality checks in your production line so that you have more quality products, right? But to do that, you'll need a lot more people to do QA on the production floor, and you'll have a lot of expenses. So because of that, and also management need to know that these are the risks that we have with our devices, so we better fix it, right? So this is a company-wide effort. So that's why top management also always need to be a reviewer, including QA or regulatory or product development. When top management is in the risk management documents, they know the risk and they know they'll give you what types of risk control measures it needs to be implemented, right? That's a basic gist of it. We're getting close. We have one more video lecture to cover, and after that we'll be done. I hope this was informative, and I'll see you in the next lecture. Thank you.